Hi, Dr. Brill here. I want to talk about what we do exactly in the exam room. Back when I graduated in 1978, we had all sorts of things we had to do. It was called a 21-point exam. And then we were supposed to check, chain, and type. We had all sorts of analysis of Sheard's criteria, Percival's criteria, try to figure out what an RX was. But a lot of it was geared toward doing vision therapy. So we had to fill out these forms, and the test actually would take about 45 minutes, an hour. I know a colleague of mine that does still an hour and a half exam. So patients right now don't want that. I mean, I walk in the exam room after they've had a comprehensive screening, and the patients are thinking, so what do I need? And I haven't even done my part of the exam. They want us to be expeditious. They want us to be efficient. They want to get in, get out, get what they want done. And they're kind of expecting that. So are we losing patients because we are not really meeting their needs? How much of the exam that you do is really not directed toward helping the patient? So we have things to talk about. We have to talk about maybe this is our dry eye spot here. Do they need IPL? Do they need LipiFlow? Do they need all sorts of other treatments? And maybe we're just collecting data. And if we're not doing vision therapy, why are we collecting the data? Obviously, if they're a strabismus, you're going to be able to tell. Or if you're going to refer to a vision therapy specialist, they're going to make the measurements anyway. Are we talking to them about their eye pressure and their corneal hysteresis, their auto-refraction, their Optomap, the panoramic view of the inside of your eye, or let's say their macular pigment optical density? Are we making it meaningful for them? Or are we just collecting data and wasting time? So patients want us to be more efficient, and we're more efficient. That gives them more time to spend learning about other aspects of their eyes, whether they're good contact lens wearer or specialty eyeglasses. Think about what you're doing in the exam room, and is it beneficial? Is it lean? Is it for the patient's benefit, or is it because you're worried about your professor coming in and auditing your chart and seeing you actually didn't do a 14B for you? So let's be more efficient. Let's help the patient. Let's be more comprehensive, but maybe we can save time. And the patients save time, they will be more likely to refer to you and come back and refer others.